So we're very lucky to have Patrick Crombez, who is chair of the Advocacy Working Group of EONS, the A in Care. And Patrick's going to talk to us today about advocacy. So welcome, Patrick.
Thank you very much, Teresa. Can you hear me? Yeah? So I also am really very glad to be here, and I already had the opportunity yesterday to visit the University Hospital and to exchange with colleagues. So it was very rich to have these conversations. And my talk here will be about cancer nursing advocacy. And I remember when I came in the EONS board, it was at the same time to be co-chair of the Advocacy Working Group. And it took me about a year to understand what are they doing. I didn't understand it. And even language, terms, abbreviations were used. I didn't understand anything. So it's just to say that even if you are in a group, it still can be challenging to really understand it. And I must say that one of the most important things was to go for really concrete projects, and then effectively you can better understand what advocacy is. So I will have a little explanation about what is and try to explain it. A word about barriers and facilitators to cancer nursing advocacy. Why is cancer nursing advocacy important? The process, how to achieve it, and some examples of current activities of the Advocacy Working Group who are illustrating concretely advocacy and a conclusion. So when I did a review in the literature about the words around cancer nursing advocacy, finally I find a lot of publications about patient advocacy. So it is clearly different, but there is material in the literature about patient advocacy, and that is something that we know very well because we are doing it every day in our practice. Nevertheless, the definitions about cancer nursing practice are very varied, and so they are not also every time very precise. So using knowledge and expertise to advocate for the profession of nursing and cancer nursing is different than the work about patient advocacy. So it is about politics, which means that we have to stand up and to let hear our voice at the right moment and at the right places. That is very, very important. And it is also about convincing people who care about our ideas to make decisions on other levels so that it is changing the landscape of cancer nursing. So it is also very important to collaborate, because without collaboration it is more difficult to raise your voice and to let it to spread it out, especially if you're working at an international level like the European level. And so collaborations with other societies, who can be professional societies but also patients organizations, can be a good way to reach out also the extent of EONS and also of other societies. So it includes to be actively engaged, and that is a demand which is not so easy to realize all the time. And the idea is to develop cancer care and on a political level, so the policies about cancer care, we have to be engaged to change them, but also to implement these changes and to achieve finally an impact which is very important on cancer care outcomes. So when we are talking about advocacy, and one starting point is important, and that is having ideas, having goals. And when you balance the quality of ideas with the efficiency of advocating, then you, oh, excuse me, sorry. You can see that there are different situations. I hope we try to be more kindly with the buttons. So quality of an idea can be good, it can also be poor, and advocacy, when you're advocating, it can be effective but also not effective. And so you can see here, if the quality of the idea is poor and you also have not a good way of advocating, then you probably could have a lucky break. It could be very nice to exchange, but it will not advance the achievement of the idea. So it is important to have a good idea and also to be effective in advocating. And then you will achieve success. And I think we can be very proud about the RECAN project, and we can also be very proud about this first European Cancer Nursing Day. It are really initiatives who spread out and who really raises the voice of cancer nurses in Europe, which is certainly very important. And we also hope that the first European Cancer Nursing Day will influence also the outcome, we are sure about it, of the RECAN project. Okay, but there are barriers to do advocacy for the profession, and you can see here on the list some barriers for advocacy. Feelings of powerlessness, and we have sometimes also these feelings in clinical practice. When doctors are dominant and always taking decisions, we are tending to listen and not to contradict the ideas of doctors. A lack of policy and political content in our education is also a barrier, and the logical consequence is a lack of policy and political skills. Fragmentation of the profession can also be a barrier, and I think it is an important thing to keep in mind, because we have now more and more specialized nurse organizations, but at the end we don't have to forget that finally we are all nurses. If we are specialized oncology nurses, specialized diabetes nurses, we are all nurses, and so we must be careful about the fact that specialization and fragmentation will not lead to a barrier for advocacy, in the sense that we are not talking anymore the same language. Lack of motivation can play a role. Limited communication skills, risk of advocacy in that way that when you stand up and you go to politicians and start a discussion, it could be in a certain way conflicting and it can be difficult sometimes, and so we must be aware of that, and it is a point that is creating a fear among nurses. Also time shortage and heavy workload. On the other side, there are also facilitators to advocacy, and we see that people who are taking up leadership roles in their even daily practice are also often nurses who can easily take up advocacy roles outside the work situation. Knowledge and skills are very important. Learning from an example, successful leaders, is just what Paul was talking about. Affiliation with professional nursing organization is also a good way to go in taking up positions and also to spread the advocacy, and that's one of the reasons that there is an advocacy working group inside EONS. And also self-interest and motivation can be an important facilitator. So why must we do cancer nursing advocacy? Well, we see that there are a lot of challenges in the future and also already now, and we have to face them. And I think we have different levels of challenges. You have levels who are rather on, excuse me again, on the political level, which can be financial pressures and uncertainty regarding to how will healthcare be reformed in the future. And also regulatory agencies who want to put a lot of energy in establishing criteria to be accredited, and so that is a pressure, but it is also a reason to do nursing advocacy. There are also issues at the local clinical level, like new treatment options, and in oncology there is a rapidly evolution in the last years, and also the need for innovative new patient-centered care, cancer care models to develop and to adapt it also to the evolution on the medical side. Changes in population, or a lot of migrations of population, and so we have to face also transcultural issues, which is not also always easy, and so to develop also transcultural competence. And that is also an issue which can in the future be very important, more and more important, and also to develop an important impact on the level of cancer nursing advocacy. Workforce shortages and increase of the median age of nurses also are important issues. So finally, it's a question about what are resource allocations doing with our workforce and cancer nursing practice, and what is the effect on our work environment, and how can we act to change and to make it still very good opportunities for us. But so at the same time, cancer nursing advocacy is a question of defending our own profession as cancer nurses, but also have a greater voice in healthcare policy in general. So when we look at the ideal model of high quality cancer care, you see that we are already very active, and the level of patients for patient advocacy, but we can do more outside around the patients, and that is the whole political area, the area also of increasing performance and increasing quality of care. And there we can take central positions, and the role of cancer nursing advocacy is certainly very important. So we must have a voice, which means that we must be full partners in discussions there where decisions are made, and that we must also be fully engaged, actively engaged in the implementing of changes in healthcare models. We also have to be involved in an effective workforce planning and policy making, and so it must be seen as rather something that we can shape. It is an opportunity to do cancer nursing advocacy, rather than say it's something that happens and we will wait, but what will come. So we can have different levels of doing advocacy. You can do it on your unit to change, for example, implementing evidence-based practice. You can also do it on the level of organizations. That can be a hospital, it can also be a professional organization, or even in collaboration with patient organizations. You have the national political level and also the international European level, which is the case for the activities around EONS. So quickly, the process of cancer nursing advocacy is a process similar to the development of projects in general. And first point is to start with defining an issue, a problem, to inquire it, and to do research. And that is what Danny said about the RECAN project in phase 1. There was a research review of the literature about the added value of cancer nursing. And we go now into phase 2. The RECAN project will be a field experience in the European countries. So we will have finally a lot of findings and recommendations. And in phase 3, we have to be active on the political level, and that will means that we will have to reach politicians on the EU level, European Commission, but also the European Parliament, to to bring this information, this data, and also in the hope that finally policymakers accepted the recognition of cancer nursing, and finally that it can be implemented, but we don't have to forget afterwards to evaluate the whole process again. This time I just pushed. Okay. How we can achieve it? Well, there are some central points, skills we have to develop. One is problem solving, which means that the idea or the question, the problem, the issue that we want to bring up must be very well identified. And finally, there must be a strategy to achieve these goals that must be developed, and also to address the issues. Finally, developing a plan of action, which is very important. And also, and that's an issue which is not so easy to do, is to find the appropriate time and persons to approach when we want to finally talk to decision makers and to convince them. So negotiation is important, but also making compromise. Communication is very important. It must be clear, concise communication. And what is very important is to be factual and consistent. So very clear, and sometimes what can help is to add a human face to the information to the issue that we want to bring up, and using narratives or example stories can sometimes be much clearer than just give facts. Influence, we have effectively, if we want to exercise cancer nursing advocacy, we must influence people. But influence in a good way means convincing people about our beliefs, our ideas, but in respect with trust with on the both sides, so which will be a process of balancing and also to see which is the best way to convince and to influence decision makers. Sometimes you can also go a little more further and really try to persuade decision makers. But normally, when you are in a phase of persuading people, politicians, it could be sometimes have the opposite effect. And sometimes politicians or decision makers can say, stop, you are going too far now, too quickly. So it must be well balanced, and sometimes it is better to keep that attitude in smaller groups. Collaboration, like I already said, and it can be important to, at some levels, have effectively some aid from the legislative people who are really active at the political level, and or assistance from the Commission. But it's important to collaborate, because collaboration will be much easier to achieve the final goal. So, what is EONS, or what are some examples of advocacy activities EONS are doing? We have the European Cancer Nursing Day. The Advocacy Working Group did a big job on that issue. In collaboration with the Communication Working Group, it was really a nice project to set up. It put a lot of people put a lot of energy in it, but when we see the tweets and Facebook now, that we can be really very proud. Regarding to the RECAN project, we will especially be more involved in phase 2 and 3, but like Danny said, all the working groups are involved in the RECAN project, but we are now already, as Advocacy Working Group, preparing some approaches on the EU level. And how do we do that? For example, we have a collaboration with ESNO, which is the European Specialized Nurses Organization, and I'm representing EONS in ESNO. They developed a common training framework, which is a tool that can be used to obtain recognition of a specialization in nursing on the EU level. So it is very important to collaborate and to see if the common training framework can also be used for the recognition of the specialty of cancer nursing on the EU level. We also do participation in EU meetings for cancer-related issues. There was last week 2 meetings in 1 week, one on the biosimilars organized by the European Commission, and another about, it was an European expert group on hazardous drugs, and we talked this morning about safety regarding to chemotherapy. That was also an issue where only a few people, finally 10-15 people, are meeting a whole day and working on issues that are important regarding to the subject, and it is important to have a nurse in there. And so we participating at these meetings is also meeting people, new people, sometimes people from the European Commission, and also raise a voice regarding to typical cancer issues at the EU level. And that is also a very important work, which is done a little bit behind the screen, but certainly important. Development of position statements, you can see if you go to the website, EONS website, under advocacy, there are several position statements. We updated the last year, the one on the role of cancer nurses, and we added 2 new position statements, one on education and the other on just the cross-cultural issues and cross-cultural competence in cancer care. And we also have the role to represent views of cancer nurses in the European policy arena. So in conclusion, we know that cancer care is changing. It is changing rapidly, and that also the practice of cancer nursing is changing. We have to follow the evolution in cancer care in general. We can't stay behind. So it means that advocacy skills and doing cancer nursing advocacy in the future will be a more and more important issue. So it creates also new challenges for both cancer nurses, but also for cancer nursing to be recognized as a specialty. And it creates also opportunities to build on our public image in the whole society. I think it is also important because it is not only working behind or inside professional context and the political context, there is also the view of the whole society regarding to us as cancer nursing, who is very important. So it will certainly be important to have also education programs, and like Paul already said about leadership, will be an important way to reinforce the profession through advocacy. And so we will support the views of cancer nurses in Europe at the political level. That is one of the major issues, aims of the advocacy working group and the cancer nursing advocacy in general. And we are convinced that you as Estonian society, you can also do a lot about cancer nursing advocacy inside your unit, but also outside your unit, I'm sure. Thank you very much.
Again, that was excellent timing, Patrick. Have we got any questions for Patrick? Sarah?
Tere, minunimion Sara, maulen sundinut Portugalis, and that's only what I can say in Estonia.
Oh, very good.
I was fortunate to do my Erasmus here 10 years ago, so I lived here for 4 months. And I know how much you nurses, Estonian nurses, struggle in your work, and you have very difficult working conditions. So a big clap for you. I think that today this initiative was incredible, and as Patrick said, I think that you can lead some really nice interventions here in your country and to Europe if you stay together. That's the most important thing. You have your national society. I know that you are only a few nurses. You are a small country. Sometimes that makes things easier. When countries are too big, communication can get a bit more difficult. So get this as an advantage and work together, and please feel free, I say that as a member of EONS, to ask for support every time that you need. Okay? Thank you.
Thank you, Patrick. That was really, really good. And I think it's clear to us that we all can do. Advocacy is nothing that they only do in Brussels. Even if you live in Brussels, it's something we all can do in all our unit. And I can say, after having a mobile phone, an iPad, and a computer here today, I can see we've seen a tsunami of cancer nursing advocacy today. So it's been absolutely fantastic. And the whole world have been following us today. So that's fantastic.
Yeah.
And I also want to challenge my great friends here, Lemelise and Hilary, because yesterday when we visited their hospital, both of them said, "No, I'm only a nurse." And I told them, never, ever, ever, ever say that again, because you should be so proud of the work you do and never say that you're only a nurse. Promise? Yes. Yeah, and you? Good.
Thank you. So thank you very much. It's certainly been a really eventful and exciting day, and we've heard from speakers, but we've also had contributions from all of yourselves, contribution at breaks, at lunch, and it's been really good for all of us here. So, Aita, is that thank you? I think that's thank you. So it just leaves me then to introduce our two presidents to do the discussion and closing remarks. So that's Professor Daniel Kelly of EONS and your own president of the Estonian Society, Christina Karp.
So, thank you very much, EONS, for this insightful and engaging day, for your knowledges. Thank you very much. Today we have discussed the challenges faced by the multidisciplinary team during the daily management of cancer patients. And I think the aim was to show up that we have the same issues to discuss. And it really brings closer to us together. So the cancer nurse roles have been introduced in many countries, and today we are so lucky to celebrate first European Cancer Nursing Day here in Tallinn, Estonia, with Estonian cancer nurses. It's a big deal, really. So I think by recognizing this day, it's the biggest compliment that cancer nurse can have. So we are very grateful to all EONS team for your work and support for this conference. And now I would like to invite my friend Hilary here to get little presents for all of EONS team.
Is this microphone working? Yes, it is. Sorry. So I really want to say thank you for everybody here. Without you, this event wouldn't happen. So thank you all the members who joined for this lovely day. And especially I want to say thank you for my colleagues who have been supported me during trying to organize this this event, and especially I want to say thank you for Katrin, for my boss. Maybe she can stand up, okay? Because. our amazing chief nurse. Is it correct? The unit chief nurse, who have made really grateful schedules for me that I could work and do the work what I'm doing in oncology nursing society. So also I want to say thank you for everybody else, especially in Estonian port, who have helped to take this event as far as it is. And especially I would like to ask Lemme-Liis and Liisi to come and help me. And I want to introduce them because tomorrow we have our own Estonian Society conference. And in the end of the conference, we have general meeting where we will elect new board. So I want to introduce Lemme-Liis as one candidate for our board. And I really hope that Sarah and Lemme-Liis and Liisi will start doing co-working about our young cancer nursing, whatever they are doing. And Liisi also have showed up enthusiasm and wishing to start doing this grateful work what we are doing in our board. So she is also setting up her candidature. So now I'm sorry I can't pronounce all your family names, but I know all your first names, so I will just say, especially I want to say thank you for Lena and her sweet husband, who has safely drove them to Tartu and back. So maybe, could you come here, please? I want to hug you. So, thank you. So, we have lovely book. We have lovely book. It's for Estonian photographer who have put here lovely pictures about Estonia, because it's only for our lovely guests.
Yeah. Okay,
because everybody else in Estonia can go and see those places themselves. And also, yes. And also we have handmade bowl. It's boat to show how we try to go on. And in this boat we have Estonian sweets. So you can use this boat as a sweet boat on your desk, or you can cook burn, actually. You can burn your food because it takes like 300 degrees.
Okay. I will burn my
Thank
food.
you very much.
Thank you so much.
And for next, I would like to say thank you for Iveta, who helped us to organize this event. Thank you, Iveta. EONS President Daniel. Patrick, who was also in Tartu with us. Christina. Wait.
You got excited.
She is treasurer of EONS. Thank you for your presentation. Thank you for coming so far.
Thank you very much.
Rebecca. Thank you very much.
Oh. Thank you. Make me feel comfortable. Thank you.
Andreas.
so much.
Erik?
Emma.
Thank you. Teresa Weisman, I have to introduce her because she is our contact person at EONS, and with her we will start doing more, co-working more. Thank you. And I would like to say thank you for Rudy. Where is Rudy?
Hello. Big profit of things. Thank you.
And also, I would like to say thank you for the supporters who had also presentations here. Hanna from Pfizer. Thank you very much. I don't know how to pronounce it. Ida? Ida? And from Codan, Rebecca? Okay. Well, we will give this later than to them. So thank you very much. And let's hope that tomorrow we have the same nice day.
Thank you, Hilary. I'm not going to keep you very long, don't worry. I just want to say thanks also to Lena. Without Lena, this would never have happened. So thank you, Lena. You made it happen. For today, I'd like to thank Teresa. Fantastic job. And of course to you for coming and for staying. So I'm not going to say very much. I'm just going to read a few words that I've collected today. And I'll just leave you with some words to think about. Politics, safety, leadership, burnout, teams, symptoms, healthy workplace, quality of life, effective leadership, past, present, and future. Thank you very much.